All right, we are joined now by Dr. Florence Baingana, the World Health Organization African Regional Advisor on Mental Health and Substance Abuse. Dr. Baingana, thank you so much for joining us here on Africa Live. Let me start by saying that this day is marked at a time when the world has been devastated by the COVID-19 pandemic. How do you see the pandemic impacting people's mental health?
Thank you for having me here for the interview. Yes, indeed, the pandemic has had an impact on people's mental health. First of all, the strict lockdown measures, as well as children being put out of schools and businesses being locked up, had an impact on livelihoods of people, and that led to frustration. It led to depression and anxiety over how they're going to survive from now till the end of the year, maybe even up to next year, because of this loss of livelihood. On top of that, there's the worry about falling sick. Healthcare workers who have to work sometimes without adequate PPE have a big worry about falling sick, about maybe infecting their loved ones, and that too leads to a lot of anxiety and a lot of worry. But we also know that when people do get the COVID-19 and they recover, some of them have had neurological problems like loss of smell, loss of taste, Guillain-Barré syndrome, which means weakness in the arms and the legs, severe headaches, and some people take a very long time before they recover from these conditions. Some people are also reporting cases of PTSD, post-traumatic stress disorder, as a result of having had the severe COVID-19. So these would be some of the mental health effects.
Well, Doctor, those are important statements you've made there. Doctor, we have just featured a story based on Human Rights Watch's report on mentally ill people. Listen to this: being kept in chains for years by their families. What other options do you think such families have in order to make life better for the mentally ill?
Yes, yes. Unfortunately, that report did come out, and it's a problem which is worldwide. In the Africa region, and maybe other parts of the world as well, the reason why families are locking up their relatives is because of the myths and the misperceptions that surround mental conditions. So sometimes people believe you're possessed by a spirit, sometimes they believe you're bewitched, sometimes they believe that they may believe that they have nothing else they can do. They may not know about where the services are and where they can get help. Many people believe that there's no treatment for these conditions. Some also believe that they are transmitted. There are those who believe, for instance, epilepsy, if you were to step or touch the saliva of somebody with epilepsy, which is a neurological condition, people will believe that you may pass it on to somebody else. The other one may be helplessness. They may not know what to do with somebody who may be a little bit difficult to control, or who could get lost, harm himself, or maybe cause harm to others. So some of these are the reasons why people lock up or chain their people with mental health conditions. What we advise is they should go to the nearest health center. Here in the Africa region, we are rolling out what is called the WHO MHGAP intervention guide, where we train lower level healthcare workers so they are able to recognize and manage these kinds of conditions. So almost any clinic that is close to you should be able to recognize and manage these conditions. If they cannot, they would then refer you to the next level of care, and the next level if they can't manage it, so that by the end of it, you get a diagnosis, or their patient gets a diagnosis, is put on the right treatment, and when they recover, they go back to the community as soon as possible. The idea is also to build up as much as possible community as well as primary healthcare mental health services. So hopefully this will be rolling out soon. Many countries are already rolling out MHGAP. It's being done in Uganda, in Kenya, In the French-speaking countries, in Burkina Faso, they have translated it into French. It's being rolled out there in Ghana, in Nigeria, almost every country in the African region, Sierra Leone, Liberia, they are all rolling out watchdog.
All right, Doctor, on top of all of what you've just said, an emerging issue today is the addiction to social media and suicides and depression among youth bullied on the social media space. Now, is the world paying enough attention to this right now? And what is your advice to parents on this?
Yes, I believe the world is paying attention to this. And unfortunately, because of the lockdowns and the children being out of school, um, the social media addiction has risen as a result of the lockdown. But I will say that the world is paying attention. In 2013, social media addiction was included in the DSM-5. That's the diagnostic system for the American Psychiatric Association. In 2014, every single year since 2014 until last year, there have been WHO meetings on social addiction. So it's also included in the WHO diagnostic system, and the public health implications are recognized, and they have also developed guidelines to help with the management of social media addiction. The advice for parents is to begin very early on managing how much time the child spends on social media. So when the children are very young, there's no need to give them a phone and have them on social media 24/7. Maybe even limiting how much TV time they spend is a good idea, so that you begin very early on. You don't have to fight with them when they are teenagers, because they already know that there's a system in place to manage the time that they're going to spend on social media. The other way is the parents need to be open to talking to their children all the time. If the parents say we are going to limit social media for you, the children, but then the parents are sitting on social media 24/7 and not interacting with the children, that can be a problem. So if the parents too take time away from social media to do things away from that, play board games, go outside, do outside activities, engage with the children, bond with your children, talk to them and get to know what's going on with them. Very often, suicide happens because the children believe they cannot talk about some of the things going on in their lives. They are being bullied and they believe they have nobody they can talk to about it. So keeping an open space to always communicate with your children is one way you can also prevent bullying on social media. The others is also peer-to-peer support, encourage peer-to-peer support. So if one child in a social media platform sees that some bullying is going on, they should be aware that they can communicate to others and say, this is wrong and we don't think we should be doing this, or report it to an adult so that they can put a stop to it. These are some of the things I would recommend. Thank you.
Dr. Baingana, once again, we appreciate you talking to us. Thank you for bringing all of that there to light.